What causes skin cancer?
In skin cancer, there is a genetic tendency of having cancer, and if that person recurrently go into the exposure of strong sunlight or some chemicals, then person can have skin cancer. Generally, we Indians are not developing that much skin cancer, but because of some
Can sweat during sports, gym, yoga can cause any skin damage?
sweating can cause irritation in few areas like your flexures, means your groin, your axilla, neckline. All these areas are very sensitive and they are prone to more sweating as well as friction also. So after these activities, you should.
So what are the disadvantages if we use retinol in early age?
Retinol is very strong molecule. It produces inflammation on your superficial skin. After applying retinol, if you go to sunlight, there may be irritant dermatitis or photoallergic dermatitis, or even
Nowadays there is so much hype of vitamin C serum, so can everybody use it?
vitamin C is very good antioxidant, but it is very unstable formulation. So it is not for everyone. Many patients got.
So how does diet affect our skin health? Can you suggest some food items that we should eat for healthy skin?
Diet definitely affect your skin. Whatever disease you develop with your lifestyle, with your food, it will appear first on your skin. For glowing skin, you should have.
Dr. Hetal Patel is a consultant dermatologist practicing at Shri Skin Clinic, Valsad for the past 12 years. She has completed her MBBS and DDLL from a prestigious BJ Medical College, Ahmedabad, securing the highest rank in Gujarat University during her postgraduate training. So let's get ready on how to take care of our skin. So let's get started.
So firstly, I want to ask you that as summers has been started, so what could we do for it to make our skin better?
See, this year, as we know, temperature is about to reach up to 45 or 50 degrees Celsius. So, in such a heat, first thing is to avoid direct sunlight exposure in peak hours, like from 10 a.m. in the morning to 4 o'clock in the evening. Even after that, we need to go out. We first protection is physical barrier, means umbrella. You can use hats, you can use caps, full sleeve clothes. Clothes also gives very good protection. There is a parameter to measure how clothes are protecting us from sunlight, that is called UPF, ultraviolet protection factor. The clothes who are having UPF of 15 to 24 can give a protection as a good. If it is from 25 to 39, it will be better, and from 40 to 50, it will be best or excellent. So it depends upon what are the color of clothes, how they are weaved, and material of cloth is also very important. So we can use a full sleeve clothes when go out in sunlight, but some people who are working with field work, but because of some cosmetic concern, they cannot use umbrellas, hats, or this full sleeve clothes. For them, sunscreen is best. So we need to protect our skin in this hot summer.
But even sunscreen has chemicals in it, so is it safe to use?
Yeah, it is a very good question. Nowadays, we all know there are chemicals in this sunscreen and all. Sunscreen are basically of two type. One is mineral type and another one is chemical type. So mineral sunscreen is having zinc oxide and titanium dioxide. They just form layer on the skin. So they do not penetrate beyond stratum corneum. Stratum corneum is a uppermost layer of the skin. So there is no chance of any kind of penetration within skin and any side effect. And another one is chemical sunscreen. There are lots of study happened in USA and European countries on the safety of sunscreen. There are so many filters nowadays which are safe to use. So sunscreen are basically safe, whether it is chemical or it is physical. But those who are having lots of fear about this penetration and side effect, they can shift to physical sunscreen.
So how frequent we should reapply sunscreen?
Sunscreen should be reapplied at every 2 to 3 hours when we are on field.
So are the home remedies also beneficial for skin?
Yeah, there are home remedies which are very much useful for your skin, just like aloe vera, coconut oil, some moisturizer. Definitely they are useful for barrier function, but not for sun protection. For sun protection, we need sunscreen only.
But we have listened in recent that basin can remove tannings.
Basin is also a type of what we can say a herb. It's a herbal remedy. We can use it for mild kind of tanning. We can use it, but generally we do not advise because people don't know about their skin. If a dry skin person apply basin, then it can cause irritant dermatitis or excessive dryness to his or her skin. So it is advisable to use anything under expert supervision. If you are having a very good skin, then just maintain it.
So how can we know what's our skin type?
Yeah, there are three type of skin mainly: normal skin, dry skin, and another one is oily. And few people are having combined skin. As you are a student, so if I say for pediatric patient, means patient below age of 8 years, they are having only normal skin and dry skin. That we can know by ask the patient or child to wash his or her face with good cleanser, and then allow him or her to sit in a room with normal temperature, and then just stretch out or check his or her skin. If there is a flakiness, if there is a dryness, roughness, then that means it is a dry kind of skin. If it is nothing like that, no oil, then it is normal skin. If there is oil all over the face without exposure to sweat, then it is oily skin. And few people are having oil on T-zone, mainly on upper lip, chin and nose, and they are having dryness on cheeks. That means it is combination type of skin.
Like what if we apply new products on skin and we get itchiness?
That means that product is not suitable to you. Every product is not made for everyone, right? That means you have irritation to that product, so you should stop using that product and you can apply moisturizer, or if there is major issue, you can consult your nearby dermatologist.
So it depends on our sunscreen that what kind of product we should use on our skin.
It depends upon your skin type. If you are having oily skin, then you can use oil control moisturizer. You are having gel based sunscreen. If you are having dry skin, then you can use moisturizer and any kind of cream or water based sunscreen.
Can sweat during sports, gym, yoga can cause any skin damage?
Yeah, sweating can cause irritation in few areas like your flexures, means your groin, your axilla, neckline. All these areas are very sensitive and they are prone to more sweating as well as friction also. So after these activities, you should take bathing, and after that you can apply some good quality of moisturizer, particularly coconut oil, because coconut oil is having fungistatic activity. It doesn't allow fungus to grow in this region. So if you are having tendency to develop this kind of reaction, then you can use it.
How often should we wash our face?
Basically, minimum 2 times daily we should wash our face. We should not wash very much frequently, 6 or 7 times, because it can cause dryness or barrier function damage.
And is using soap on the face okay?
So those are having harsh chemical are not safe for face. For face we should have mild kind of cleanser or mild kind of soap with a pH balance.
And what about what skincare routine should we follow?
Basically, for students, I say there is nothing like a strict skincare routine. We should have moisturizer. If we are going out, we should have sunscreen and good cleanser. That's enough.
Are expensive products really worth it?
Uh, Good skincare doesn't mean expensive products. It means how your skin is accepting that product. So you should know your skin type first, and you can accordingly select whether it is expensive or it is affordable. That's fine.
And talking about the teens, what are the most common mistakes they make?
Okay, so there are lots of trends in this social media era, right? DIY, this and those, and Korean glass, and everything is there. But each and every trend is not suitable for everyone, right? And you student don't need to go such a deep level. You should have moisturizer, sunscreen, cleanser. That's okay. If you are having acne, oily skin, then you can shift to some serum or some special kind of product. Otherwise, no need to go for a trend.
Is it important to oil hair, or should we oil it overnight or just an hour or two before shampoo?
If you are having oily skin, oily hairs, and there is a dandruff kind of thing, you can wash on alternative basis. In this Valsad, there is humidity is a lot, so we can wash at least twice a week, 2 times a week.
But is it important to wash hair and before we apply oil or something else?
Oil is a good hair moisturizer. You can apply 2 hours before hair wash, or you can keep it overnight. It's your choice. But if you are having tendency of acne or lots of oil on your face also and scalp also, then just apply oil on your scalp, hair, and after 2 hours you can wash it out.
Because of oily hair, we can have dandruff, and which can cause pimples also.
Reason for pimples and dandruff is common. That is our hormone. So dandruff can also lead to acne, And basically it's androgen sensitivity, what we can say.
Now my next question is, what causes hair fall?
Okay, that is good, very good question for teenagers, because we are having lots of patients with hair fall during teenage. So first we should know why hair fall is there. Hair fall can be genetic. If your parents are having some disease related to hair, you can have hair fall. Second most common is some diseases like typhoid, malaria, dengue, COVID. It all these diseases causes hair fall afterwards. Third one is lifestyle, which is most common among teenagers. Improper food, improper sleep, sedentary lifestyle. This can cause hair fall. And in case of girls, there are lots of cases of anemia, means lower HB. So it is also a cause for hair fall. Vitamin D, ferritin, vitamin B12, sometimes thyroid disorder. All these factors can cause hair fall.
Do food habits like eating chips, chocolates, or junk food or sugary drinks can cause acne?
Definitely. All these foods are high glycemic food. So they increases insulin level, they activate androgens and it causes acne.
The sugar we use in day-to-day life, is it like good for our health
Not good.
and our skin?
No, it is not good for your skin. Similarly, sugar can cause acne, sugar can cause dandruff, sugar can cause acanthosis nigricans, that is darkening on your neck, on your axilla, even on forehead. All these diseases can occur because of sugar along with sedentary lifestyle.
So at what point should we consult a doctor or dermatologist?
Regarding acne,
Yes.
yeah. See, if you are having one or two acne, occasional acne, it is not necessary to consult dermatologist. But if you are having acne that are large, red, inflamed acne, if they leave scars, if they leave a lot of pigmentation, if it is disturbing your mental status, you feel depressed. If there is a recurrent acne for a longer period of time, then you should go to dermatologist.
So how does diet affects our skin health? Can you suggest some food items that we should eat for healthy skin?
Yeah. See, first you should know skin is the largest organ of body. It is a very important organ and it reflects your internal health. So diet definitely affect your skin. Whatever disease you develop with your lifestyle, with your food, it will appear first on your skin. And after that you got some particular disease like diabetes or something else, right? So we should have proper food intake. I cannot say particularly this thing you should have for your glowing skin. For glowing skin you should have balanced diet. It should have fiber, it should have minerals, it should have vitamins, it should have carbohydrate, fat, everything, and protein, which is most important, right? So we cannot skip a single thing from our diet, but there should not be excess of carbohydrate, excess of fat or oil in our diet, right?
So does drinking more water actually clears the skin?
Definitely. Water is what we can say self medication for your skin. So you should have plenty of fluid daily for glowing skin because it hydrates your skin, and definitely hydration will reflect light better. So there is glow.
And apart from food and water, should we take a good sleep?
Yeah, very good question. Nowadays, I have seen so many teenagers or even elders also. They spend a lot of time on their mobile till 2 or till 1 or 12 at night. So it should not be like that. Sleep is most important and most neglected part of our health. There is a circadian rhythm, what we call biological clock of our body. So we have to do activities according to sunlight. Accordingly, there release of hormones from the body, and it will make us healthy and what can say glowing skin. So you should sleep early as possible, 3 or 4 hours after sunset, and your wake up time will be according to you. So good sleep can add your skin health as well as overall well-being also.
Like we often get pimples during our exams. So what is the cause of it?
One is stress. Stress can aggravate your acne because it increase your androgen sensitivity in oil glands, so it can lead to acne. Sometimes during exam, that student does not take proper food, proper hydration, not even a rest. So it can also aggravate your acne.
Moving on to the next, my next question is, do all influencers have perfect skin? Is it real or edited?
Okay, as we all know, there are lots of filters in each and every application, and there is makeup easily available. So I don't think all influencers are having good skin, as we see on social media. There is some problem with everyone, but we can hide easily with filters and even makeup. So it's not like that. So yeah, there may be some people who are having very good skin with the hard work, right? So it is not like that ki what you see on social media, it is same. So you will get same kind of skin with their advice. You have to read your own skin.
Nowadays, most of the treatments are done by instruments. So, is there any side effects?
See, we all know technology has changed our life. Technology has also changed medical field, particularly dermatology also. There are lots of instruments available nowadays for treatment of your skin. It is safe, but it is safe if it is done by knowledgeable person, by dermatologist, by well trained person, the person who know your skin, who know that instrument. So it is safe. Nowadays there are lots of instrument for hair removal, just like laser hair removal, for pigmentation removal, it's Q switch Nd:YAG laser, for skin tightening, for removal of wrinkles, for glowing purposes. So many instruments are there. They are safe if they are of good quality, because there is also variability in the quality of instruments also, and many times we see these treatments are done by some untrained people also. So if the people or treating person doesn't know about skin or instrument, definitely there will be a side effect. But if it is done by proper well trained person under observation of doctor, dermatologist, then definitely there is no side effect. Lasers are made to prevent side effect only and for better outcome.
Are anti-aging products only for older people, or is it harmful for our skin also?
Nowadays there is a lot of trend on social media or in real life also about anti-aging. Aging start from the age of 20 years. It occurs because of sun damage, because of oxidative stress, because of our lifestyle, hydration, all these things matters. Yeah, anti-aging products are varied from moisturizer, sunscreen to higher products like retinol and everything. So we can use moisturizer and sunscreen from the beginning, but we cannot use these stronger products in early age, particularly in your age group. There is no need to use all this. You can just simple have moisturizer, which has also anti-aging effect. So it should be used properly under the guidance of your doctor or your expert.
So, what are the disadvantages if we use retinol in early age?
If retinol is very strong molecule, it produces inflammation on your superficial skin. After applying retinol, if you go to sunlight, there may be irritant dermatitis or photoallergic dermatitis, or even you don't go to sunlight, it itself causes redness and irritation. And why you need to go for retinol? If you are having good moisturizer, you don't have that weak collagen. This retinol penetrates deeper up to collagen and it enhances the collagen production. You are having already collagen production good, so no need to use retinol in early age.
Is it necessary to apply sunscreen for kids before coming to school?
It's a good question actually. See, in Indian skin type, we are having natural melanin to protect our skin, and we are having very good sun also. So it is we can apply sunscreen to kids also. Sunscreen are safe above age of 6 months of age, as per American guidelines. But it is there is difference in American skin and Indian skin. They are having white skin, Fitzpatrick type 1 to 3 type of skin. They burns very easily. They are having chances of carcinoma more than us. So they used to apply. But in our scenario, it is not compulsory to apply sunscreen to kids, because sun exposure causes vitamin D production in our skin and in our body. So vitamin D is very important for growth and development of our bone and muscles. So I advise, if there is no such a strong sunlight, don't apply sunscreen to kids. If you are going to beach or hill station, or if there is a chances of sunburn, then only you can use it. Otherwise, in day to day life for kids, it is not compulsory to apply sunscreen. They should go out and play for better growth and development.
So, my next question is, so what is the skincare routine for monsoons and winters?
Okay. During monsoon, there is lots of humidity in atmosphere, so there is a chances of infection by bacteria on your skin is more. So we should keep our skin clean. We can use oil. We cannot use oil-based moisturizers. We can use water-based moisturizers, and we can maintain hygiene during particularly monsoon to prevent infection to our skin. And during winter, there is lots of dryness in atmosphere, so there is a barrier function damage. So we need to apply moisturizer on your skin regularly. We need to use moisturizing base cleansers or soap for our skin.
So, is face wash good for dry skin, or should we use cleansers?
For dry skin, cleansers are better.
Nowadays, there are many hair care products available in the market. So, are they reliable to use?
Okay, you are talking about hair care products, right? Okay, see, in market there are lots of products regarding cleansing, regarding conditioning, and regarding cosmetics. Shampoo, conditioner, you can use definitely according to your hair type, but cosmetic products should not be used daily or on frequent basis. Occasionally, if you are having some function or some wedding, you can use it, but not daily.
So, what is the basics hair care routine?
You should wash your hair twice weekly. You can apply oil prior to wash, 2 hour prior or a night before. And if you are having dry kind of hair, you can apply conditioner that is not on your scalp, that is on your hairs, and wash it out. That is the basic of your hair care. Main is your internal health. If you are having good internal health, your hair will be okay. If you are having bad health, then even after using all these shampoos, conditioners, and serum, you may lose your hair.
So, if we have oily scalp, we should apply hair oil.
In oily scalp during summer or monsoon, you should not. During winters or dry weather, definitely you can have it, but you should apply 2 hours prior to have wash or a night before, not more than that.
So, after pimples, we usually get dark spots. So, how can we cure it?
We have to cure pimples to cure that pigmentation. Few people are having habit of popping pimples. They excoriate their pimples. It leads to severe pigmentation. So first, whenever you get acne, don't touch it. Don't rub it or pick it out. Otherwise, pigmentation will remain for a longer period of time. If you are having a few acne, minor acne, grade 1 acne, then if there is a pigmentation after pimple, it will be okay within a month. But if you are having larger acne, nodulocystic acne, large red kind of acne, then you must have to visit dermatologist, because only tablets and creams can prevent the pigmentation, right?
So, ma'am, as I have oily skin, so which serum I should use?
There are lots of serum available in market which contain hyaluronic acid, glycolic acid, salicylic acid, lactic acid and all. So if as I have examined you, I can see you are having oily skin, mild pimples and pigmentation is also there. So definitely you can use salicylic acid based serum. Not for a longer period of time, but at least for 1 or 2 months.
So, what are disadvantages of using it for longer period of time?
It can cause irritant dermatitis on your face. And when season changes, there is already dryness in your atmosphere and you are using salicylic acid for a longer period of time, then definitely there will be inflammation on your face.
Nowadays, there is so much hype of vitamin C serum. So, can everybody use it?
Vitamin C is very good antioxidant, but it is very unstable formulation. So it is not for everyone. Many patients got irritant dermatitis, means redness with the serum. Many patients got sensitization to sun after using vitamin C serum. So it is not for everybody. It is for some selective patient, and your expert can say whether you should use or not after examination.
Can I use my parents' skincare products?
Not actually. Your parents may have different skin type. There is age difference also. You are quite young, so you cannot use their skin products. If your skin is similar, like your mom, dryness or moisture wise, so you can use her moisturizer or sunscreen. But after that, the serums and everything, whatever your parents are using, you cannot.
So my next question is makeup safe for teens?
Teens are having quite unbalanced skin because of hormonal fluctuation. So they are having oily skin most of the time. They are having acne. So I suggest you should not use makeup frequently. Occasionally you can use makeup, but all should be non-comedogenic.
Because there are chemicals also in it and it can affect us also.
Yeah, definitely it can affect your skin. So better to avoid. But in some circumstances, if you cannot avoid makeup, then you can use basic makeup product with non-comedogenic property.
Is it important to remove makeup before sleeping?
Definitely, whenever you go out and you apply makeup, when you come back to home, you should remove makeup first with proper makeup removal. Otherwise, you can be in a trouble of acne or irritant dermatitis and all.
Let's have some quick myth busters. So, the more sweets we eat, the more acne we get. Is it true?
Yeah, true.
You only need sunscreens on sunny days.
False.
More screen time or mobile use affects your skin.
Yes, definitely.
Natural things or so called home remedies are harmful.
Yeah, it can be.
How?
See, natural remedies are made up of herbs, we all know. but everything in excess is always harmful. And you don't know what contains that herbs, whether so many products contain salicylic acid, just like milk and all, right? And if you are having sensitive skin, then you can be in a trouble.
Popping pimples helps them heal faster.
No,
A longer skincare routine is better.
no.
So, how can we reduce inflammation in skin?
By proper lifestyle, good food, outdoor work, proper sleep, all these matters, along with the hygiene is also definitely a major pillar.
So, is it a myth that we should apply ice on inflammation to reduce it?
Inflammation can be reduced with the ice, but it is not compulsory to apply ice. And if you are applying, just apply for few seconds, not more than that.
So, there is a ice water therapy in trend. So, should we do it?
For skin glowing purpose, not actually.
So, what are the majority cases that you get in nowadays?
Nowadays, regarding your age group or school going kids, most common is acne, as we all know. And I have seen acne doesn't only affect your look, but few people may get depressed with the acne. They feel I should not go to school because I will not look better. My colleagues will tease me. So we should focus on this. We should support such a kids. If someone is having acne, don't tease them. It's very normal during teenage, right? It will affect their education also, and their presence in school also. Another is infection. We are facing so many infection among kids, particularly fungal infection during this summer season as well as monsoon also. So generally fungal infections are seen in flexures, mainly on groin or under the breast or in axilla. So students feel shy to share all these things with their parents. So when they feel uncontrollable urge to itch, they go to their parents and say, I have developed this kind of disease. And when they come to us, there is lots of redness, lots of infection on their body. So I suggest students should not be shy regarding anything happen to their skin. Initially it is just mild redness, so that student or that kid feel it is just a redness, it will be vanished. He or she wait for a long, if it doesn't get control, then he or she come to us. So I suggest you should inform your parents if anything happen to you in your skin, whether it is simple red patch or simple acne like lesion or simple bulla, means vesicle. There is chicken pox also. Nowadays in heat we see lots of cases of chicken pox. This chicken pox are small fluid filled vesicles seen on body. So a kid is always like, it was a simple bulla, so I didn't bother. But it can be chicken pox, it can be herpes. Herpes are also nowadays seen among pediatric population also. Another is bacterial infection in this summer, malaria, what we call garmi in our local language, right? This malaria is very common in this May, when we are having a hot and humid climate. Sometimes this malaria get infected and there is pain, there is pus formation. So all these things are very common in pediatric population. One rare thing which is not seen in this summer, but we see during winters and when there is seasonal changes, that is atopic dermatitis. It is a kind of allergy that develops due to dry weather or dust exposure or some chemical exposure or some kind of clothes. That is also very common.
So, nowadays pollution is also increasing. So, should we cover our face?
Yeah, definitely. Pollution can affect your skin directly. And in the people who are already having some diseases, acne or allergic dermatitis or atopic dermatitis, they should cover their face when they go out.
Like, how can we reduce our tanning?
We can reduce the tanning. Simple tanning can go by itself also if it is mild. If there is a strong tanning, we can use some serum, some cream, or some treatments are also available, chemical peeling or laser toning. We can easily remove it.
In these days, people often use pimple patches to cover their pimples. So, is it really helpful?
So we should know that what is there in pimple patch. If it is simple salicylic acid patch, definitely you can have it for 1 or 2 pimple. If there is some strong chemical, after application you feel there is a lots of burning, lots of irritation, you should not use this.
Nowadays, SPF jackets are also trending. So, is it like myth or fact?
First, we should know what is SPF. SPF is sun protection factor. It suggests how long or how amount of UVB light can be protected with this sunscreen. So on the earth there is UVA light and UVB light. UVB light is only 20% and 80% is UVA light. So only SPF is not that much helpful. SPF with broad spectrum sunscreen, should actually be used because they cover all UVA and UVB both.
So, can you explain UVA light and UVB light in detail?
There is a spectrum of light which reaches on Earth. They are having UVA, UVB, and UVC light. Harmful or light which cause inflammation is UVA and UVB. In this spectrum, 20% light which reaches to the Earth's surface is UVB light, and 80% is UVA light. UVA light is having two different spectrum, that is UVA1 and UVA2. UVA2 is having similar effect like UVB. It can cause cancer, it can cause sunburn, it can cause irritant dermatitis. UVA1 light is quite mild kind of light. It can cause simple tanning or redness.
So, is it safe to use fairness creams?
Fairness cream in concern of camouflage creams, which are just after application gives you feeling of fairer skin, is okay. It is just like a makeup, you can use it. But fairness in the terms of some drugs, nowadays we see so many people are using some creams which contain steroids and strong hydroquinone and all in this cream. They use it for longer period of time. Temporarily it gives white skin, so they happily uses it for a longer duration of time, and after that they develop dependency on that cream. Whenever they try to stop this cream, they develop redness, they develop again pigmentation, so they cannot stop it. And even after that, they develop redness and sun sensitivity with that cream itself. So that is very complicated thing, and we should not use this kind of cream which contain drugs or some cosmetic molecules. Definitely we can use, or camouflage cream we can definitely use. Fairness is not about white skin, it's about healthy skin. If you are having good hydrated and healthy skin, then it's okay, we not change the color of your skin. We are Indians and our skin is going to be darker than American or European countries or Korean countries. We cannot be like that. So just accept your color and move on. Color is always beautiful. So if there is acne, there is pigmentation, we can treat it, but we cannot change the color of your skin.
What causes skin cancer?
So in skin cancer, there is a genetic tendency of having cancer, and if that person recurrently go into the exposure of strong sunlight or some chemicals, then person can have skin cancer. It is not so much common in our country. It is very much common in white skin people. According to our medical terminology, there is Fitzpatrick skin type 1 to 6. 1 is most fair skin and 6 is most dark skin. So skin type 1, 2, 3 are vulnerable to skin carcinoma, so they are using lots of sunscreen on their face as well as on their body. We are lucky, we are having skin type 4, 5, 3, 4, 4 or 5. We are lucky because we are having already melanin in our skin. Whenever we go out in sunlight, we become tanned out. Why? Because our melanin production increases and it form layer on our skin. So our skin get protection from sunlight. So generally we Indians are not developing that much skin cancer, but because of some environmental factor and genetic tendency, people are having skin cancer, but it is very less in number in India.
So, is it a myth that we get thick hair after shaving?
We don't get thicker after shaving. It's upon hair root. What we are shaving is external part of your hair. Whether you cut it or thread it or shave it, doesn't matter. If your hair follicle is terminal, then there is thick hair.
Thank you so much, ma'am, for coming in our podcast. It was very informative and we had fun asking you questions.
Thank you. I enjoyed a lot.